अस्सलाम वालेकुम एवरीवन। आई होप यू ऑल आर डूइंग ग्रेट इन योर लाइव्स। आज की वीडियो जैसे कि आपने टाइटल देख के समझ लिया होगा, इट्स अबाउट करियर काउंसलिंग. So I'm going to tell you today that what are basically the options you can opt for after doing your MBBS degree. So one is if you are willing to live in Pakistan, then there are various options like these which I'm going to discuss today in this video. Or if you're not gonna live here in Pakistan and you want to go abroad, like in any other country, then there are other options for which I'll make another video, inshallah ta'ala, the next video, part 2 of this video. So, in Pakistan, what are the options? Like after doing your MBBS, you can opt for number one, an exam FCPS. College of Physicians and Surgeons basically conduct this exam, CPSP, and this FCPS is basically it stands for Fellowship in College of Physicians and Surgeons. It has got two papers, paper one and paper two, right? Both of which are of 1 hour duration, and in between there is a break of half an hour. So, what is that basically? Paper one would contain all the subjects which you did in your MBBS all the years, right? While paper two is specialty wise, and specialty wise means that if you are to opt medicine in your future, then you will go for medicine and allied, इसी तरह surgery and allied, dermatology, there are ENT, many options, right? Then the fee is 25,000. It has been increased for the past years, and पहले ये जो है वो 15,000 होती थी. So it is conducted 4 times a year, but a candidate can only give 3 times per year, and it is conducted after every 3 months, right? Then this was one option. Second one is MD-MS, right? MD stands for Doctor of Medicine, and MS stands for Master in Surgery, right? It is conducted 2 times per year. The merit is very high in this. There is option of research, which is to be considered very important in doing MSMD, right? While if you compare it from FCPS, so in FCPS there is a criteria, उसमें हमें research चाहिए होता है. The house job, if to be done from the parent institute, that is important, that carries marks. Then BHU experience, basic health unit experience, it has got 10 marks. And there is a certain criteria which you have to met, which is to be met if you want to come in the merit list, and if you wanna do the degree, if you wanna be doing the degree through SIP, that is Central Induction Policy, उसके थ्रू अगर आपको ट्रेनिंग अपनी आगे रेजिडेंसी करनी है, राइट? देन आफ्टर FCPS 1 यू हैव टू डू FCPS 2. जब 4 साल की ट्रेनिंग हो जाती है, देन FCPS 2 करना होता है. उसमें देयर इज़ the main talks stations comes, and when you're done with this part 2, then you can write this FCPS on your prescriptions. Okay. In MDMS there is only one paper, right? In contrast to FCPS, which has got two papers, paper 1 and paper 2. It's got only one paper in it, right? Its merit is very high, so yeah, many people go for this FCPS degree. Then the third option is MCPS, right? Now it is basically not something like these. You have to apply for it. It has got the duration of 2 years. ठीक है, 2 साल में आपने इसमें अप्लाई करना होता है, और then you can be called as a consultant after applying here, right? So in this regard, as compared to that of FCPS, in which you have to do 4 years of training to be called as a consultant, while in MCPS you are to be called as consultant after only 2 years of training, right? So this is a good point of it. And also you can in this MCPS you can open your private clinic, लेकिन जॉब इसमें थोड़ा सा मुश्किल से मिलती है. Okay, the fourth option which you can opt for is diploma, right? Diplomas may this is good for private setup. If you want to open a private setup, you can opt for many diplomas. There are many of them. You can become general physician via it. You can become a family medicine practitioner, right? देन एक बहुत कम इंस्टीट्यूट्स हैं जो कि ये डिप्लोमास करा रहे हैं. एक है लाहौर में, इंडस हॉस्पिटल, दैट इज़ वन ऑप्शन. Okay, then you'll be called as a half consultant after doing this. Then the last option is, last but not least, is your private clinic. If one is to opt for this is a very good option. कारोबार में बहुत पैसा है. कारोबार जो है ना, जो भी बंदा करता है वो रोता नहीं है. So this is the best option of, if you can ask from me among all of these. You can start your clinic right away from the beginning, right? And yeah, these are some of the options you can opt for after doing MBBS, and if you are gonna live in Pakistan, right? So the next video is about what options you can opt for if you don't want to live in Pakistan, if you need to go abroad, right? So without delay, just hit the subscribe button if you really liked my video. Like, share, subscribe, and don't forget to share it with your friends, because sharing is caring. And if you'll share it all with your friends, maybe they are in need of such a video which actually explains all of the things really good. So thank you so much for watching. Have a nice day. Allah Hafiz.